everybody. This is Erica Mello and Susan Clinton, and I'm thrilled to be doing this next podcast. He's a really interesting patient, and we're in late October, and it's fall. I mean, happy fall, people. We have all the Halloween decorations and Christmas decorations here, and it's warm here in New York, so we haven't had any leaves change yet, but it certainly will. So this patient's really interesting. He is a full-time office worker, but history of concussion and judo and dance, and his symptoms were basically he felt twisted. That was his chief complaint, and we go through a really interesting analysis. Actually, it's a two-parter about why his cranium was and his dura were primarily the sources of his issue. So I hope you enjoy it, and thank you so much again for listening. Hey everybody, this is Erica Mello with my co-host Susan Clinton, the podcast Tough to Treat, a physiotherapist guide to treating the complex patient. And we have a complex patient today. Let me tell you, it's my turn to discuss a patient, and I'm actually still treating this guy. He's been coming in for a while, and it's been a work in progress, and it's been fun. He's really into it. It's a great guy, and as I'm just going through his notes here, his chart's like this thick. And he's referred to me by an acupuncturist, and he's been seeing her on and off for many years. He's really into the holistic, view of life and treatment and health and such. So he was 59. I think he probably turned 60 since I've started seeing him. His chief complaint, he basically came into me and he said he had right-sided discomfort, and he pointed literally from his head to his foot. And he said he felt twisted. And I was like, usually I'm jumping at these. I'm like, this is great. I can figure this out, and we just clicked immediately. And he had also been to many physiotherapists before and just didn't have great results. And I think the acupuncturist begged him, please, you have to go one more time, and he did. And I'm glad he did. It's been a great relationship. I have to say he's a great guy. So that was his basic complaint. Not like ton of pain, like not sharp pain, mostly just discomfort. And he also complained of right-sided neck spasms. He didn't call it pain, but he would have these spasms in the right side of his neck. And basically it sort of started when he was doing something very still, like sitting still, standing still. And what made him better was basic stretching and hot yoga. So just a basic background on this guy. He played judo for many, many, many years, and he currently works at a local college here in New York City. He had studied ballet, jazz, and just very sort of active in those types of activities. He had several concussions, obviously from all the head and body hits in judo. And his background, his surgical history is unbelievable. He's had, let's see, probably 3 knee scopes on his right knee. He had a left knee scope. This is probably since 2009. He had a partial total knee replacement on his right side. So that's 4.
Partial. That's interesting.
Yep. And so 3 scopes plus the partial total knee, a left total hip replacement, a right AC joint reconstruction. 2015, he had his foot scoped, just cleaning out stuff. And then last year he had his right knee scoped again. And major concussions over the years. And he kept saying that he compensated for his AC joint. He had this unstable AC joint by hiking his shoulder up and sort of coming into this cocoon-like posture, which he thinks set off his headaches at some point. And he's had several, when he was 22 years old, he was put in lumbar traction. He's had several MRIs and just the basic things of aging, stenosis here and there, some degenerative stuff, which makes sense because he's had so many body hits over the years. Mm-hmm. So then he had a cortisone shot in his left hip just before he saw me. So he came in with all of that. So I was like, okay, where do I start, with somebody like that?
Uh-huh.
And he's tough. So I'm trying to think if there's anything else I mixed. I mean, no other past medication's really minimal. I mean, nothing really, to be honest. So, and I'm just looking at his eval, which was a while ago. So he's come a long way. I'll just preface this that I've been treating him for a while and he's made great progress, but I'm at a point where I'm kind of stuck. So this will be a different sort of a podcast will be a back and forth, which is great. So I'll
Sounds good.
just took a quick look at his standing, because that standing still was an issue for him. So I looked at that, and his sole center of mass was shifted to the right, and he was stood with his neck in this sort of left side bend. So left side bend, sort of whole thorax, pelvis to the right. He had, his feet were almost like into this supinated, rigid foot type. He had a basic pelvic, we look at the sort of pelvic rotation to the right side, and everything seemed to be to the right. His head, although he was left side bend, he was rotated to the right. Everything was on his right leg, his pelvis, his thorax, everything to the right. I'm like, no wonder you feel twisted. I didn't tell him that, but I'm like, no wonder you feel that way, because you've been doing well, and his system seems to have figured a way out to manage. But, but as we went through the evaluation, his neck and his spasms in his neck, I think, were the main issue, and he had issues with breathing. He kept pointing to his diaphragm. So when in standing, I just said, let me just try something to intervene into the nervous system, because I'm not about to sit there and fix the neck and the thorax. So all I did was I just got his center of mass over his base of support, and I corrected his pelvis. I just sort of neutralized it basically, and all of a sudden he started to breathe deeply, and I was like, okay, that's a start. He's actually breathing, and he noticed that. And the good thing about this guy was that he's into this, and so he's a very great body sense. And he said, wow, I really feel better. I feel easier. And I did the same thing with the thorax. I corrected that, and it just felt better. When I took a few Baral classes, the visceral stuff a few years ago, I ended up learning how to do a listening technique, which is you put your hand on the head, on the cranium, and you give a fascial load, and you sort of see where it's drawn, see where the energy in the hand is drawn to. And I've been practicing that quite a bit since I've taken the course. And I did it with him because he was so complicated, and I just wanted to see where it was going. And their whole view is like the body hugs the current lesion, so to speak. And when I did it with him, I was pulled right into his head, and I was like, okay, interesting. And I just let it go. So throughout the whole, evaluation, he was mentioning certain things that were also harder. He had a hard time lifting his leg up, his right leg up, his active straight leg raise. I did the things in standing, and then I got almost like a buy-in. He's like, oh God, I feel so much better. I'm breathing better. And I said, and I just didn't say anything because I thought that was great, but I know this guy was very complicated, and I didn't think that was going to be that easy with him. So he also had a problem sitting. And so I had him just do a basic squat for that. I didn't see anything really crazy with that as either, except his head kept shifting. So in the absence of, in the lieu of time for the first visit, he said, I also have an issue lifting my legs. So I just had him do that real quick. And I did the same corrections I did in standing, his pelvis and his thorax. And he also felt much, much better. So then I went into his head, and I just had him lie flat on the table, because I just had this funny feeling that because of his history, right? With the head hits and the body hits with judo, major concussions. I just had a funny feeling something was going on up there. And because he was in this really weird position with the head. So I had him lie down, supine, flat, no pillow, and I just got on the cranium in the head, and I just put my hands there. I didn't really do anything. And all of a sudden he started to take deep breaths. I guess that little input into the brain, just with my fingertips, he started to take deep breaths. And I said, you know what, let's just do your straight leg raise since we're in this position, even though it's not, it doesn't bother you, like it's not your main issue. And he's like, sounds good. And he did, and it flew through right up immediately. So I said, oh my gosh, you have something going on in the up in the neck, whether it's the CV joints or the cranium.
It's interesting that you bring up the CV joints, because the first thing I thought of when you talked about him with that left side bending right rotation, that's generally a pattern that you see in the upper cervical joints, versus the lower cervical, where they tend to rotate and side bend the same direction.
Right.
It's a bit like a torticollis.
Yeah, that's a great point. Yeah, totally. Yeah. Yeah, awesome. So he also, I'm here, I think it's sometimes when we see patients like this, we kind of go down many routes, and I was trying not to do that, because I was getting great results with what I had. Just
Mm-hmm.
in this interim, I knew he wasn't going to carry it over because he's had this for so long, and I needed to give him some movement things. And he kept saying to me, and he kept putting his hand under the axilla and unloading his shoulder blade. And I'm like, he's like, when I always do this and it makes me feel better. And I'm like, what makes you feel better? Do you feel untwisted, or do you feel like you have less neck pain or less neck spasms? He's like, my neck feels better. He said, I still feel twisted, but my neck feels better. I said, so he had a couple of issues, I think, the sense of twist and then this neck issue. So what I did was, because I was running out of time, and I was over an hour at this point with this client, So I actually did a scapula unloading tape. And I said to myself, I am unloading that could be the nerves up in the neck. It could be part of the brachial plexus. It could be just unloading the whole right side of your neck and your shoulder girdle. And then when I did that, he was like, oh, this feels so much better. So that was the first visit. And that's all I did with him. I wanted to get a basic, roadmap for the next visit. And he came in, I'll just go quick because I want to just talk about where I am now. And he came in and he felt a lot better. And over time, the second visit, he started talking about, the x-rays and the things that I gave him. And I was like, yes, you have you expect to see x-rays like this of your lumbar spine and your neck, given your past history of judo. It's not unusual. So I said, don't focus on that. Just focus on you as a person. You are not a piece of paper. And so over the next several sessions, I worked on his neck and in his cranium. And I remember when you're in the course that you give, Susan, the diaphragm, with the whole breathing. So I felt like the right side of his diaphragm, I felt, was so restricted. So when I did a listening in supine with the head, just doing some craniosacral stuff, I took Doreen Killen. She's a physical therapist up in Montreal. I've taken a couple of her craniosacral courses, and I've done a little bit of work, with that, as well as on the Discover Physio series I took in 2012. And so I just started playing around with releasing sutures in his neck, and the sutures on the cranium, and just doing some things with the CV joints, general, release work. He's not stiff, so I didn't need to mobilize, C1. But sometimes I find that if I do a little bit of oscillatory technique, some of the tone decreases in the neck. So I was doing that, and then he felt significantly better, and I felt that I needed to go to explore the diaphragm, And in terms of the diaphragm, remember I talked to you a while ago about the diaphragm and its connection with the cranium or something like that? So I wasn't quite sure what that was. So I ended up just working on his diaphragm, because whenever he said he had neck pain, he would go into this cocoon-like, and it would be almost like left rotation head, like a fetal position, like he wants his nervous system's protecting him, right? So, and that's why the diaphragm got hypertonic, and then his neck would go into spasm. So over many, many treatment sessions, we worked on releasing the diaphragm, working on his neck, and he got a lot better. His sitting was better. His standing was better. And then, in terms of movement practice, I basically gave him, because he was so visual, I gave him a couple cues to release the muscles in his upper neck and kind of correct his cranium, so to speak. And I did it with a visual. So I said, imagine, sometimes I say things like, imagine you've got a guy wire in between your C1 and C2, and he gets this. So I spoke to him in our language, and it's opening up. It's opening up, like decompressing. It's elongating your spine. And then I also gave him some cues with regards to neutralizing the position of his head. And he did that. And then I retested things. I retested his active straight leg raise. I retested his standing position, and everything just felt so much better. Subjectively and objectively, everything seemed to sort of just not line up, but he was breathing better. His head sort of shifted back into neutral. And the thing with me was the breath. He took a deeper breath. So that's what I've been doing. And I did give him a couple So I had him do some low level things with all that. We call them phase 1 exercises. I had him do just to keep the neck unloaded, tricep things, reverse flies, tricep extension in supine, just imagining releasing the muscles in his neck and releasing and sort of neutralizing his cranium. He did well with that. But he kept getting, every 2 to 3 weeks, his neck would go into spasm. And what we figured out was that it's whenever he had to lift and move things. Now, when he was sitting, he was fine. Standing, he was fine. But he wants to go back to at least teaching judo. He's not going to probably play anymore. And then I was like, okay, we need to reassess everything, because there's something that I may have missed, or we just need to progressively load your exercise program. And every single time, so I don't know, I started doing a bit of work with the Dural system in the Baral courses as well. So every time I not slumped him, but sort of did a whole sort of chin tuck, slump, straight leg raise, everything just wound him up. And he said when he feels like this, when he tells me he goes into this cocoon position, it's, from what I know, and you correct me if you know something else, that's your nervous system saying, I don't like to be lengthened. I want to just shorten a little bit. And so whenever he tried to lengthen, when he was lifting or doing some more of these loaded tasks, the nervous system just said, okay, I don't like this anymore, and I'm going to close you up somewhere, whether it's your thorax or your foot or your neck. And that's where I am. So I've been doing, this is many treatments, I've been doing some dural, release techniques as well, and just still working on the cranium. He's doing pretty good, okay? However, last time I saw him, he didn't sleep very much, and he had a lot of stress. His mother passed away, and then he started getting the neck symptoms again. And I just feel that he's made so much progress, but I need to get him to a point where he can lift. He's also a part-time artist where he can move things out of his studio, lift a piece of luggage, not have, neck spasms every 3 to 4 weeks. And they don't last very long anymore. He said it's been, the recovery is much better. But I'm just wondering if there's still something in his cranium, his dural system. There's something that I either is missed, or I just need to really sort of start to load him more, which I've done. So, and that's a really, really quick snapshot of him. And you need so many other things, but the general trend is significantly better. And we're just trying to, as I said, get him to load and get him not to have these neck spasms anymore. And so there I am, and I'm, so I'd love your thoughts, and maybe we can work through it.
Yeah, absolutely. I was taking some notes here as you were talking, just so we could kind of go through some things.
Probably sounded really confusing to people who are listening, but I tried to make it as easy as I could.
So some of the things that stood out to me were, of course, the side bending rotation issue with the upper cervical region, and it sounds like you found that as you kind of went through, and you talked about the connection of breathing to the cranium. And I think a lot of that is the idea that the brainstem runs the breathing apparatus. And, our accessory muscles, of course, are run by cranial nerves as well as upper cervical. And so I think there's a motor system as well as a neurological system, that, respiratory system, that is really very primal to people. And if his system indeed is protecting him, which it sounds like, this whole cervical, whatever he calls spasms, twisting and drawing in, it could be just a huge overprotective response. And it's it's changed. You've given him enough novel inputs, by, helping him shift his mass and, moving and doing different things, so that he can learn to get himself in different positions for more novel input to, set down some new motor patterns, which is great until you get stressed.
Right.
Or until, or he perceives the threat as lifting something, he goes to lift, and perhaps just even the idea of it is enough to drive that system, back going again. And I love the idea that you took him into what you call phase 1, because it's like, let's just get moving without the threat.
Right.
And now you're kind of struggling, it sounds like, as he's beginning to enter into some of these situations that were considered threats before.
Right.
he's been able to do some and get himself through it a little bit better, but he's still having that response. And
Right.
instead of it being a pain response, it's this, spasm drawing in kind of other response.
Right.
Which is very, very interesting. And his breathing changes with it, which, really sounds to me that it's really kind of, again, I like to use that word primal, but I use that, as rather than a word like primitive, because I don't like primitive.
Right.
But I really think it's, it's a protective response for sure. And so the breathing becomes more shallow. It's kind of a sympathetic, response to, I need to get away from this, for whatever's happening. And boy, with the, the history of the judo, it certainly sounds like, he's had enough, head bangs and neck twists and flying through the air stuff and all of those that are marked by that. I also find it's very interesting the way that he can kind of understand movement because of his ballet and jazz background as well.
Yeah.
He's still actively dancing.
Yes. Yeah.
So
he does that on the weekends.
Okay.
Yeah.
And it would be, one of the things I think would be interesting is to have him just go through a basic bar with you.
Yes, yeah. He sent some videos to me of his dance class, and a lot of it is sort of these, like I don't even know the terminology, but a lot of opening, almost ballet type. I think it's more free form.
Okay,
but we could do that. I mean,
yeah, I would have him just basically do a basic bar for you. Just say, show me. You walk into class, you grab hold of the bar, just kind of go through your routine, and watch his movement and see if he's able to. If he brings him, where his struggle is, you'll be able to pick it up. But it'd be interesting to see if it really is, if it's something how, he's doing, and maybe the cues for his upper neck can be something that you can take right into that.
Yeah.
To help him begin to, lay that down in a different level under a different circumstance. He obviously enjoys it or he wouldn't go.
Yeah.
And, it's that combination of movement and music and breathing and all of those good things. But it'd be good to see kind of what his tendencies are. And then look at him when he's lifting and see where, maybe be able to bridge that gap just a little bit. Okay, when you lift, you tend to, here's a hypothetical. When you lift, you tend to grit your teeth and, you tense up before you head to the box or, something like that.
Yeah.
Is when you do that same movement over here, you're doing this. Let's bring this movement into this, or let's take this movement into that. A way to, that maybe language-wise, motorically will translate over a little bit better to help him work through that thread of some of that heavier loading that you're starting to work him in.
Yeah, it's interesting because so I gave him a couple things. If anything happened, when I like either in between sessions or when he was away, and I gave him basic child's pose, and I also gave him just some things where he's supine and he does a little chin tuck and he does some heel slides, alternating, just sort of lengthening the system a bit. So I did give him those in case he had an issue, and those helped him when he did get those spasms. And I also just did, that was, more what we call like not a reset exercise, but something like that'll just, sort of calm the nervous system down. And that helped. And he also I had him do also, because he had the issue with his neck, like he could feel when he was sort of in that left side bend position. So I basically had him just do your cueing with your neck and just turn your head to the right and to the left and just note the ease of movement, and then do your cue and turn your head to the right and the left, and you'll know that you've got the cue down, and then you could proceed with your workout or your day. So that he's good with. And I'm just wondering if he has a gym in his building, and I gave him, just easy things like some PNF opening patterns, things like that to open up the diaphragm, some yoga poses. But he also, and I'm wondering what you think of this, because of he keeps mentioning this AC joint compression that he's had. I don't know, he had umpteen years ago, but he compensated by lifting his right shoulder up. And I'm wondering if that's still a motor pattern I need to address, because on and off I've had to tape his scapula, unload the scapula, and it makes him feel better, like instantly. So it's just literally unloading the scapula from the back. I
Mm-hmm.
just put a piece of, hypofix leukotape, and with the shoulder, in elevation, and then it just supports him there.
Mm-hmm.
And I'm wondering if that, I still do the general listening on him. I'm still pulled to the neck, but much, much less. I'm wondering if that's something that I should look at this point. No?
Well, there's two things. Number one, you already addressed one of them I was going to talk about, which was looking at peripheral nerve glides with him. When you have a system that's getting pulled in, and you're already doing that, you're getting him to lengthen his upper cervical spine and start working on driving the heels down, in a caudal direction, so that, you're beginning to lengthen the system that way. I find that the reason I'm bringing this up is the ballet and jazz and the judo he must be fairly mobile.
Oh, yes.
Or flexible.
Yes.
So here's the issue I run into when I run into particularly dancers
Mm-hmm.
that are having these very strains, that just are always seeking some way to unload their neurological system for whatever reason it is. Because it just sounds like some sort of neurological load in that right upper quadrant area that he's just so tuned into it, that he's constantly, messing with it.
Mm-hmm.
But if there is a hang up within that system, I found that if you can't do the traditional nerve, the positions like, upper limb tension positions
Mm-hmm.
aren't going to really bring it on.
Right.
Because they move so much.
Right. Right.
So I have found that, and this is something that I learned from Michelle Roy, who's a practitioner up in Montreal, and sees a tremendous number of dancers and athletes. And it was a great cue I picked up from her a number of years ago in treating this population. And it's winding up the neurological system before you get into the periphery. So in other words, if it's in his upper quarter, one of the things that I would do is wind up the lower piece of the whole neurological system in the lower quarter, and then begin to take them into some of those tension movements in the upper quarter and begin to kind of work easy, like right where that tension comes on and where it goes off. But you're not going to feel that if you don't wind up the system somewhere else because of their incredible flexibility. So for a dancer, I would take them, here's an example, I would take them into long sitting and
Mm-hmm.
flex them over. So that we really, and now in that kind of overflexed position there with their legs straight,
Mm-hmm.
and their trunk flexed over, I can begin to bring the tension into the upper part of the system, and they can start to work from there and really begin to feel that in a much different way. So with him, because he's been futzing with it and fiddling with it and pulling his shoulder up for so long, he probably has kind of lost that left-right discrimination and that ability to feel the differences in that system, because it takes such weird things to kind of do something for it,
Mm-hmm.
that if you can wind up the whole rest of the system, you might be able to bring his attention to, okay, now in this position, feel where that tension comes on, now feel it come off, and begin to start working that neural, those neural glides in that way.
In the long sit position.
Yeah, you can try it in long sit. You may have to try, you may have to sit cross-legged and bend over. You'll have to play with it, to really see. And that's why I was saying, if you can watch him move and dance, I think you'll be able to pick up some cues as to when that system, begins to come on and when it goes off. Yep. And one of the things that I would look at in the dance world, we call it port de bras, but basically what you're doing is standing with your legs straight and you're just doing a complete bend over.
Yes.
At the trunk and at the hips, and
Yep.
make sure, just see where he's bending and what's happening to his
Mm-hmm.
neck when he does that.
Yeah. Oh, yeah.
Is he being pulled kind of a little bit into his tendencies as he goes into what you would consider, wow, that neurological system's getting really pulled for him.
Yes. He does actually. He of course he goes right to the floor and through the floor below. It's how flexible he is.
Right.
But you're right. He does have that thing. He definitely is pulled to that left side.
Yeah, and I think that, so find those positions, and that's where he can, because that'll make sense to him. He can go into a partial kind of loading, so he can stand with his legs straight and begin to bend over with his arm out to the side, which is a traditional ballet jazz move, a port de bras move.
And
he can kind of begin to work his arm in and begin to work it out a bit, and he can work on doing that lengthening, that extension, that lovely piece in that upper CV part, to begin, and kind of just see how that feels when he does that. Does that change that? And maybe, he can kind of bring his arm in a little bit. Is it easier then to hold that neck position in that movement, and then begin to start kind of working, to see where, he can begin to change and get some different gliding and things going on through the system that way. The other way to do it is to have him lay on his back and bring his legs all the way up.
Yeah.
So he can hold his legs, and with the other arm he can kind of work some. So there's you can create a whole variety of variances of movement. He can also do it in sitting. Legs out straight, bend over, kind of, put a couple of pillows between his trunk and his legs so he can kind of relax down, and he can kind of work, then he's in a position kind of almost a semi-prone position with his upper quarter to kind of work in a different direction that way.
Yep.
And those may be some really cool things. And of course, the breathing with it, have him, I love what you're doing with his upper cervical spine. I just, bring that breath on with it to automate that system even a little bit more.
Yep.
That he can, give him a specific type of, or have him come up with a couple of different specific type of breathing tasks to do when he's doing that, so that all he has to think about is, I just need to breathe, and then that system will automate. And it's not something like, okay, get tall here, hold this, breathe, right here, feet here, because it gets to be too many inputs.
Yep.
It's just something that, can make it really simple coming through. But I like that. This is a classic example of when you shouldn't take a cervical spine and just do retraction exercises.
No.
Because all you're going to do is compress the CV joints further.
Yep.
And what he needs is those deep postural muscles to learn to keep automating and working to help him maintain that lovely, like you talk about that guy wire between the occiput and C2, that lengthening of that guy wire, which is basically those rotatorus muscles coming on, those suboccipital muscles coming on and fattening up and actually lifting his head up off of it instead of letting it compress down into it.
Yeah.
So
I love this. So basically, you're saying that in any kind of long sit, forward bend, just wind his system up from below, whatever it takes, and then start doing peripheral nerve glides.
Exactly. And just see if he can start to begin to detect, and start with his arm in, because he's going to want to start all the way out, because he's seeking how to get that to happen. And he's so flexible. Yeah. I'm sure he can take his arm and put it in all kinds of positions around his body. So it's like the nerve glides aren't positive. The tension test isn't positive. If you wind him up from below and wind up the neurological system, perhaps maybe then you'll be able to feel where, and he'll be able to compare it right to left.
Well, it's interesting, for sure, because when this was a while ago in supine, I had him, what was I doing? I was just sort of holding the neck a little bit on tension, and I didn't just kept it there. I didn't have him do anything else. And I said, just do lower trunk rotation, do a couple active straight leg raises. On one of his, I think it was his left side, when he did the active straight leg raise, I felt my hands, his head was practically sliding down to the end of the table. So I'm sitting, I have basically my hand on his head, just making sure it doesn't rotate side bend or do anything funky. Then I have him do the active straight leg raise, and the pull is so strong from below that I literally, I'm sweating. So there's something, I said to myself, there's some pull in that nervous system that was I think the key. And my issue now is I just have to figure out ways. I love this. Just building right off of that is really cool, because if he's just doing a straight leg raise and it's pulling that much, you could just put a wedge underneath his legs. Yeah. And he could even be a little bit more relaxed there, and then see what's the difference in those upper limb tension tests from right to left. Yeah. And where do you bring that on? It may not be that traditional, radial, median, ulnar nerve type movement. It may be a combination, it's right there. And it may have a little bit to do with maybe, a learned response from his judo, or a fall down the stairs with an outstretched arm. It could be it could be 100 different things that have kind of entered into his neurological system at the same direction. Yeah. That's kind of caused this wind up. One of the other things that I thought was very cool that you talked about was the sense of twist
that he has, and then the position of his head and the neck, and how, you know, that gets pulled into everything. And so part of that is going to be kind of a locking down of that vestibular system. He's been this way, you said, for so long that's what his vestibular system is probably, and his motor system around it is perceiving as normal.
Yes.
So there's probably, even though he can come out of it and make that change, the system has been laid down for so long that the tendency is going to be always to be drawn back to, because the system is going to do whatever it does with the head and the neck to get the eyes on the horizon again.
Yep.
And so you may pull out of it and, I can breathe better and all of this is good, but it's not a strong enough input to, over time, and, you know, change that. So that's why the change is so slow, I think, that you're seeing, is because you're battling a really kind of strong pattern in that vestibular system. And he's got beautiful balance around it, or he couldn't be doing ballet and jazz.
Yeah.
You know, so it's become kind of you're really working with a high level patient,
right?
You know, a high level person that's just got these subtle motor things going on, and they're tricky, because it's like, wow, you know, because he can, you know, people would say, well, he moves beautifully, what's the deal? Well, he wants to be different, and he doesn't want to feel these feelings, so you're trying to help him begin to learn new ways to do things. But that compression with loading is interesting too. And I'm just wondering if he just kind of locks back into that as he goes. But with the vestibular system, you might even try, since you're doing so much with the head and neck, and you've probably done some of this, is some eye exercises and things around it as well. So when he's when he's, you know, which is, again, the bar piece, I think, is fun. The dance piece is to get him into some of those movements. And in that movement where he feels good and he's tall, and, you know, these symmetrical, or these things that he's seeking in his system, is bring the eye movements in there at that point, because that whole ocular cervical reflex is going to be huge, because the eyes need to be very, very mobile in that change of head and neck position, so that his brain will feel like we can keep our eyes on the horizon, which is a huge driving piece. You know, we know this, that people will turn their body inside out to keep their eyes on the horizon. It's just such a, you know, major focus for us as humans, to not be walking around with our eyes lopsided. I mean, people really side bend their trunks and do all kinds, and twist and rotate and drop legs and do things to get those eyes level, you know, if they've got restrictions up ahead.
That's interesting, because at one point I had him just do a couple things with his eyes, but I just sort of let that go, you know, to the side. But I love the idea of using more like looking at the visual field and just trying to see where his eyes go, because I think so you're saying to do that while he's doing his dance, while he's doing any kind of movements. So
as you wind up his system, have him do that then, because that's all part of that. But also, just when you're working on just the basic standing, and he knows how to change things in order to breathe deeper. I love using the breathing part, because it's something he obviously can identify right into, and it's like, I feel good when I'm like this, and so let's use that. When he's in that position and he feels like he's breathing deeper, then that may be a time to kind of start helping him reorganize, the eye movement and stuff. And he can also vocalize at that point in time too. Maybe he can go up and down with his voice, you know, to bring that piece in, you know, some of that oral musculature stuff, anything that can bring those newer novel inputs into his cranial nerve system.
That's great. I love it.
Because they all hook up all the way around. And if he's, you know, if there's a stress response or a protective response that's going on, you know, that's trigeminal. So I think the final thing about that is, when he is going into his spasms, or what he calls his spasms, or his period of time where he doesn't feel good, it might be interesting to have him check his heart rate.
Oh, interesting.
See if his heart rate's up. Because then he can probably begin to maybe use breathing and long exhales to begin to bring the heart rate down, which might be another novel input into the system to help him begin to change and reorganize out of that familiar pull.
I think, that's great. I think he may be doing something like that, but I have not had him check his heart rate, and I think that's a great idea. It's interesting, because he he's been doing, he can do, you know, he can sit and stand now, and he can do some low load things, but he really wants to do this judo and start to, you know, just live, you know, lift and live more normally. And to him, he's made great progress. He says, my recovery time is, when I get them is much lower. But to me, I think that, I want to be able to get him to lift a box without going into a neck spasm. And consistent thing on and off over these months that has helped him, whatever issue he's had, is unloading that right shoulder blade, so, and I'm thinking, well, it's got to be unloading something up in the head. It is, so, but I love the because he compensated like that for years. He tells that every time.
This is a loop that's been there for a very long time.
Yeah, because he had that surgery, that AC joint reconstruction, way after he had dislocated, and way after. I mean, there was many years while he compensated that way, and it's been a long time when he finally got the surgery. But he probably still has the same motor pattern. So I love the idea of doing the peripheral nerve things, with the eye muscles, and then doing just getting into a movement pattern. And I'm wondering, in terms of just because I've given him some things to do with, like, he's off those phase 1 exercises now, I think. But I'm wondering if I should have him start lifting a little bit in terms of heavier things.
Yeah, I don't see why not, especially if you're going to work on helping him continue to, change that neurological nudge that he's got going on in the system. Sometimes when we challenge the system in different ways, it might be a cue, particularly if you start in maybe something that he feels like is non-threatening. You'll have to ask him, what is it? Maybe even just pose that, getting some graded motor imagery. Just close your eyes and imagine yourself lifting something heavy. What does that feel like to you? What's happening in your body? So that he can begin to maybe work through some of those things and say, what would feel like a much less of a threat that is something you need to do in your life every day right now that we can start working towards. And it may be something as simple as the easel. If you said he's working on art, right? And
he paints.
So it may be the easel, and here's something else to look at too. Show me what it looks like when you're painting.
Oh, I love that.
Put yourself. I need to see you paint. Show me.
And he's right-handed, I believe. He's right-handed. I love that. That's great. He's a pretty good artist too, I have to say.
I imagine so. He's got so much life experience to bring to the table. And
oh my God.
So into his movement patterns and all the things that are happening with him. So
I know. And I was just looking while you were talking at the last note that I wrote on him, and which was probably 10 days ago. He what am I writing? He had an issue with squatting. This was just like a one-off thing. And he said, I couldn't squat down low to pick up something off the ground. And I was like, and I know with patients like this, we want to help them with whatever they come in with, but with him, I'm trying to stay the course here because I think it's all related. Anyway, I just watched him squat, and, because of the hip issue, it's his left, he had the left total hip replacement, the right total knee, and the multiple scopes. So his quads on that right side are quite, hypertonic. So I had him do his sort of cue again, with the head. I didn't look at the shoulder at that point, but I just almost like unloaded his hip a little bit. And then I just sort of pulled on his sit bone and just sort of lifted it up like a lift, basically. And I just said, squat now. And he squatted right to the floor. No problem.
Yeah, just needed to change
the input. So that's not one of his major issues, but I just noticed that was the last thing when he came in with.
But what's interesting about that though is that he's, we all have these different kinds of movements that we struggle with every once in a while, and we never think to stop at the time that it happens and say, can I change how I'm doing this so I can do it better?
Right.
And so that's what you did, was like, just try it this way. What happens if this is like this, and all of a sudden it's, enough of a trick that the system goes, oh, we're out of pattern. We can do this a little differently. But I think that kind of goes back, to that whole, just where he tends to like, so some of the squatting may be that kind of piece that goes into lifting, like I can't get to the floor, so there's a struggle. If I had to put something heavy into my arms, that would be another struggle. And so then that racetrack,
Yep.
that system that's so set up into the the side bending and the muscle spasms in the neck, make it just be kind of just that first output that comes in.
Yep.
Like, whoops, okay, here we go.
Yep. It's also, I noticed I've been taping him occasionally, but he's getting like kind of itchy and red from the tape at this point. So I don't think that's going to be an option going forward in terms of doing the scapular unloading tape. So I think that I'm just going to have to, I'm going to play with all this stuff. I think this is great. It's just because when you see patients and you're like, this guy I've been seeing, I love working with him. And I just stuck at a plateau because he's made so much progress, but he and I both want him to return to judo or at least be able to lift things.
Sure.
And
I think that if that's his jam, he should be able to do it.
And judo, I think he should be fine. I'm more concerned about the lifting than I am about the judo. Because I think his system will figure a way out in terms of the judo moves and things like that. But I'm not sure when I'm seeing him next, but I will progress, put him through all these things unless you have any other suggestions, and then I can report back.
Yeah, this is going to be good. I'd like to kind of hear back about some of the things we talked about and see how he responds. The one final thing on him is considering that, around the grief of the loss of his mother brought all of his symptoms back on, which just shows us how incredible the brain is, and that any inputs that are conceived dangerous, including grief, can really fire up, our protective responses in however way they choose to be expressed. Does he have somebody, like, is he in some counseling? Does he have a good cognitive behavioral therapist? There may be some deeper kinds of emotional pieces that are part of the system as well, too. And something that he might want to consider, especially since he was able to connect that, around the time of this, that grief, everybody expresses it in such a different way. And sometimes we think we're fine. Our culture says, you're fine, you're fine, you're fine, you're fine. And 6 months later, we wonder why we're sitting in a chair drooling, because we're not fine, because, it is something that needs to be. So, I don't know, any of the rest of his history and any of that stuff, but, with head injuries and, competition and all kinds of different things, there may be some other little pieces in there that, if he started to sort some of those out too, could be very, very helpful to his being able to change his protective response even a little bit more. Just as a thought, mainly because the reason I bring it up is because you had said that he was doing really well until the loss of his mother, and he had kind of a bit of a flare up, and I actually think that is instructive. Much as we don't want people to have flare-ups when they do happen, it informs us a little bit more about our protective system, and it's like, wow, there's really some, that it's quite sensitive enough that the emotional system is really, a driver in there too. Yeah,
and it's interesting. I'll just, one more thing. I was just going through the notes, and I didn't really put him through like a major gym exercise program. And we have a Pilates Cadillac and reformer in our gym. And I had him do a couple things, roll down, sort of opening up moves, things like that. And he doesn't have access to that out of our facility. So he ended up doing just some things in his own little gym in his building. But it was really more, it was specific to him. And it was because he's so involved in his body and he really gets it. He was devising things on his own, at one point. He's like, let me try this and let me try this. And I think that's the beauty of the nervous system for him. He just figured out ways to get the job done. And it makes, my job easier in retrospect. So, for people who are thinking they have to put all these people on exercises, that's not really true.
Absolutely.
If anything, it's you don't want to do the wrong thing with somebody like this. So let their bodies figure it out, and you can sort of finesse it along the way. So great. And I'll report back. I think I'm seeing him soon, so I will maybe on the next podcast I'll report back and
that'll be fantastic.
How it went.
Love to see kind of what his responses are, and
totally,
and what you guys were able to figure out.
Yeah, cool.
Sounds great.
So we'll see each other on the next one.